From Press Communications LLC, this is Jersey Shore Matters with Dianne DeOliveira.
2.5 years after the COVID-19 pandemic turned our lives and world upside down, the mental health crisis continues to surface now more than ever, and it's important to draw attention to the issue during this National Suicide Prevention Awareness Month. Good morning, I'm Dianne DeOliveira, and joining me today is Maureen Underwood, a licensed clinical social worker who serves as the Monmouth County Mental Health Association's consultant on suicide prevention. She is a national expert on suicide prevention and the author of Lifelines, an evidence-based youth suicide prevention program used in New Jersey and nationally. Thank you so much for being on the show, Maureen.
Oh, you're welcome. I'm glad to be here.
As an expert in the field, how profound of an impact has COVID had on our mental health?
You know, what I would say is, you don't even need to be an expert in the field to really take a look around and see the dramatic increase in all kinds of mental health challenges. There's the Mental Health America has a variety of online screening tools that they use, and I just wanted to share this number with you and your listeners because I think this was overwhelming for me. The number of people looking online for help with mental health increased 500% from 2019 to 2021.
That's staggering. Now, is that just in the U.S. or is that worldwide?
That's just in the U.S.
Wow.
Just in the U.S. Yeah, so to me, that number says it all. The largest increase they found were inquiries from parents and youth. And, apropos of what we're talking about today, they found that suicidal ideation had dramatically increased for youth, especially for Black youth and for kids who identified as LGBTQ+. Those kids, and I'm only going to share a couple numbers because they were just so overwhelming to me. 63% of the youth, and these are aged 11 to 17, who identified as LGBTQ+, reported frequent suicide ideation, not just once, but frequently thinking about suicide. That's really scary.
Yeah, that's just unimaginable, especially so young. When you think of an 11-year-old, I mean, for any teen to think about it, but that's just so young.
And that's one of the things that we've known is that in terms of visits to emergency rooms for suicide ideation, one of the largest populations to increase were those 5 to 10-year-olds.
Wow. Ugh. What are some of the reasons, we hear about depression and things like that. I mean, you mentioned the LGBTQ community. I'm sure that must be a confusing time when you're going through your, going through puberty and your early adolescent, you're already confused. But then to throw, a whole nother realm in there, what are some of the biggest reasons that are being cited? Is there anything in particular, or is it just a host of emotions?
Well, that's a great question. There are a lot of reasons that I think were generated by the COVID crisis, and some of them were, that loss of routine, not having as much social structure or social connection. We know that social connection is one of the biggest protective factors for that buffers all of us from stress in our lives. And, it was difficult to get that. There was that fear of being sick, economic insecurity. It could go on and on. But one of the things that was fascinating when in these surveys, and this was regardless of what people said what they were interested or have information about, that was anxiety, it was depression, anything else, when they asked them what was the condition that they struggled with the most, it was loneliness and isolation.
Certainly during the pandemic, I can see that. But, as we sort of return to normalcy, maybe that will turn around. But, there's just so many things. Teens are so vulnerable because they also might not have the coping skills that an adult has to overcome those types of emotions. And, just right here in Monmouth County recently, the Middletown district suffered the loss of 2 student athletes to suicide within 9 months. Is this something that is a pattern that's starting to happen nationwide, especially since COVID-19 and all of these emotions and the staggering statistics that we're seeing now?
I think suicide, especially, youth suicide is the area that I've specialized in since the 1980s, which is when we started paying attention to it. It's been around since then. The rate has gone up significantly, I think, since COVID. And what I would say is, what we're doing in Monmouth County is, we're working in schools, trying to help educators and students understand, what the mental health issues are and how important it is to be able to ask for help. We can't change everything, but one of the things we can do is let people know that they're not alone. And, I want to go back to that number that talked about they were feeling loneliness and isolated. And one of the things we know when we get to that place is we feel very stressed. The biology of stress is important to remember, because we go from that thinking part of our brain that's very logical to the survival part of our brain, and we come up with suggestions for things in our heads, our problem solving, that, aren't necessarily very helpful. So thinking about that, how do we manage to try to help people get back to that real thinking part of our brain? That's one of the things that we're doing with the programs we're doing in schools. And what I would like to suggest, to the folks who are listening to this, you can do this as well. I'm sure if you look at the people you know in your life, there's some of them that you can see look pretty hopeless and maybe isolated, and they're not themselves. And imagine if you were just simply to ask that question, you don't seem like yourself lately. I wonder what's going on. And rather than trying to fix the answer, because one of the things we know from research is that we are not a good society of listeners. We're problem solvers. We're fixers. Someone tells you a problem and you're thinking of how they can solve it. Or you're thinking of what you can tell them about your life that shows that you may have some empathy with them. It's rare that we say to somebody when they tell us a problem, wow, tell me more.
Yeah, I want to get into a little bit more about that. I just want to remind our audience that this is Jersey Shore Matters. I'm your host, Dianne DeOliveira, and I'm speaking with Maureen Underwood. She is a Monmouth County mental health clinical consultant on suicide prevention. She's a national expert on suicide prevention. And, we're discussing, it is Suicide Prevention Awareness Month, and mental health is a big part of talking about this and continuing that discussion. One of the things that you just mentioned was, if you see somebody that just doesn't seem their self, ask them, what's going on. Counselors can't always keep up with the volume of cases. What red flags should we as parents or teachers or coaches, even peers, and coworkers for that matter, be looking out for? Or, maybe sometimes people can mask that and always look happy on the outside, but not necessarily on the inside. I've seen both sides where someone who obviously is struggling has taken their life, and then someone who appeared to be the most caring, energetic, happiest person do it also. So how do you know what to look for?
That's a great question. And one of the things that we do know is, there's a large percentage of people who tell somebody that they're thinking about taking their life. And I don't know that we always take it seriously, because that's a really hard thing to hear. I've worked with a lot of parents who've lost children, and the sad stories they tell of, seeing signs and trying to just make their child better. Oh, you don't really feel that bad, or come on, things aren't that difficult. You'll get through this. Instead of really letting people talk about what's going on. The other thing I think that's important is really reinforcing that it's okay to ask for help, especially for boys.
Yeah.
In our culture, help-seeking is not a very masculine behavior. And, to model that as parents, to share with kids times in your life when you had to go ask for help from a grown-up, and find out who the grown-ups are that they trust that they would go to, and not be discouraged if they don't say your name. Because that the task of kids growing up is to separate from their families. But as long as they've got at least one trusted adult in their life that they would go to, there's some degree of protection there. The other thing I would say is notice changes in your kid's life for as little as 2 weeks. And that's not the change that they got to go up and down every day, but it's something that lasts for 2 weeks that they just don't see themselves. And that's when you're going to ask that question. You just don't see yourself. I wonder if there's something going on. And then really be open to listening to that answer.
Maureen, I've been hearing, I have a lot of friends that work in schools and just other families and parents whose children might be struggling. The case overload, counselors are overloaded. They just can't keep up. So if professional help isn't immediately available, what options do families and individuals have to seek help?
Yeah, again, you're asking wonderful questions, Diane. I think some of the good news is that, through the pandemic, we learned that virtual counseling was a possibility, and it worked. So there are organizations, there are all kinds of opportunities that people have virtually. There's other virtual counseling tools like wellness applications, there's social media, there's telephone groups. And I think that it's important to recognize just because you can't get in to see someone face to face, you really can take advantage of some of these opportunities. Mental Health Association did that last spring. We heard so many stories from educators who were overwhelmed that we actually started a program for educators where they could call and just request a therapist. These were online sessions. They were short. It was 6 sessions for 30 minutes apiece. I wasn't so sure that was going to be helpful. And I was one of the people who volunteered to do it, and I was really surprised by how those 6 sessions made such a difference. It helped people kind of clarify what their problems were, get out of that emotional part of their brain, and begin to kind of realize that maybe there was something they could do and that they were going to pursue longer-term counseling. But don't discount short-term counseling is what I'm going to say. If you can get something for a short term, take it. It can make all the difference in the world.
Yeah, and the virtual counseling, as you mentioned, how we all learned in all aspects of our jobs and life and work, is how much that really can make a difference, especially if you are someone who is dealing with a mental health issue and maybe you don't feel comfortable going face to face or walking into an office. But when you're in the comfort of your own home and you kind of can set the control and you're talking to a person online, I think that makes it a little more approachable for someone who might be hesitant to seek help.
It really does. As I said, I'm a believer from, as someone who didn't think the process could work. It really convinced me that just having someone to talk to for a short amount of time, never seeing their face.
How much mental health awareness is incorporated into daily education, and should there be more of it in the future, given the crisis that we're seeing now? Now, I know you have a book, Lifelines. I'm just curious, what prompted you to write that? I know you've been an expert in the field for a long time. Was that just something you did as part of your field, or did you feel a need to write that because of a trend or something you were seeing?
Actually, that book has been around a long time. We wrote the original edition of it in the 1980s. And the reason that we wrote it was that we got a request. I was at a mental health center. We got a request from a school counselor who said, could you come in and talk to my kids about this? So we put some curriculum together. We went and did it. And he called back the next year and said the kids loved it. And the reason it really started in the 1980s was the suicide rate for youth went up 300% from the 1950s to the 1980s.
Was there a reason for that?
Well, there's a lot of theories about it. Some of it has to do with there was also an increase in drug and alcohol use that was pretty similar. And it was for boys, not girls. We know that boys have higher rates of suicide per se, and girls have higher rates of attempts. So that was some of what went on. But it did come from a need. It came from a need articulated by a school, and we've continued it through the years. When it started, it was a program for 7th to 10th graders. Now we actually have a curriculum we use for 5th and 6th graders. We probably could have something for 4th graders. And we've got something specifically for 11th and 12th graders that talks about that transition after high school when suicide rates go up, about how to prepare yourself for life perhaps not meeting your expectations. So it's really based on what was a need in the field, and it's just grown through the years.
And is it still being incorporated today? And are you seeing that there's more of a need, or districts coming to the association to say, what else can we do, or what more can we do?
Oh, absolutely. And I think that, it is the good news that comes out of tragedies, is schools realizing they can do something, that their communities where kids come together, where parents come together, and that they can send these messages that they're not alone, that help is available. They can connect with community agencies, and there's something you can do about this. I think it's really trying to address that hopelessness that often comes when I feel like I'm alone and there's nobody who cares about me, nothing I can do. For schools to say, yes, there is, and here we're going to help you do that.
Maureen, we are almost out of time. Is there anything else that you'd like to add that we left out?
No, I think you've asked a lot of great questions, and I think the important thing I want to say is don't just think about suicide during Suicide Prevention Month. Think about it every day of the year. It's a problem that's there all the time, and when we give this special month to it, we get lots of attention, and then it kind of recedes. I would like everybody to just remember this is an everyday problem, and think about what I said of noticing someone around you who just doesn't see themselves, and ask those questions and listen to the answers.
Great advice, Maureen. Thank you so much. Maureen Underwood, she is with the Monmouth County Mental Health Association, a clinical consultant on suicide prevention and a national expert on suicide prevention. Thank you for this helpful information.
Oh, thank you, Diane, for caring about this.
You can hear Jersey Shore Matters with Dianne DeOliveira every Sunday morning on Press Communications, LLC.